Last week, I attended the Senate hearing for Veteran Affairs at Montevallo, Alabama. And this is a question that was asked to the VA and then was also asked to a civilian doctor who is also a military veteran. Check it out.
Through the VA for 5 years is hyperbaric chambers. They're obviously expensive. A lot of the VAs don't have them, don't want to spend the money on them, but no matter what
Senator
it costs,
Tommy used
we've
to
got
be
to
a
take care of our
football
veterans.
coach in Alabama.
And you know, this bill that I've presented, you have to go through 2 other therapies before you're able to use the hyperbaric. Now you can use them either in the VA or out of the VA. We've got to find, you know, some alternative way to help some of these people that some drugs don't help or other therapies. So what's your thoughts on HBOT?
He's been pushing for this for 5 years.
So in regards to hyperbaric oxygen treatment, it is FDA approved and authorized for use in a variety of different medical conditions. It has not been authorized for use as treatment for PTSD or TBI. It also is not covered and reimbursed by CMS and most private insurance as treatment for PTSD or TBI. Our review of the evidence available, and as stated in our VA DoD clinical practice guidelines, we don't find there to be sufficient evidence to support it as an evidence-based treatment.
I think that's enough of that. Next, I'm going to show you a doctor, and I can't remember his name. I'll put him in the description in just a minute. But his studies is in neuroscience and hyperbaric chambers, and this is what he had to say.
And thank you for allowing me to give some information on hyperbaric oxygen treatment for neurologic injuries in veterans. Hyperbaric oxygen is the delivery of 100% oxygen to a person in a pressurized chamber and is used as a treatment for certain diseases and conditions. Oxygen levels 7 to 14 times that achieved by breathing room air are possible. The therapy affects more than 8,100 known human genes and thousands of cellular processes, and is effective in treating a variety of conditions from neurologic injury to chronic wounds. Hyperbaric oxygen has been used as a treatment for brain and nerve injuries for 89 years, since it was first described by Dr. Albert Behnke in the U.S. Navy for the treatment of the brain and spinal cord injuries in decompression sickness. Since then, it has been used for a variety of brain and nerve injuries in addition to decompression sickness, such as carbon monoxide poisoning, stroke, post-concussion syndrome, traumatic brain injury, PTSD, depression, chronic pain syndromes, post-COVID illness, and narcotic addiction recovery. It is useful to think of the actions of hyperbaric oxygen as occurring in 4 ways in brain and nerve injury. 1, it provides oxygen to the damaged areas of the brain and spinal cord which don't have enough oxygen to function or heal. 2, it promotes the synthesis of growth factors which cause ingrowth of new blood vessels and allow nerve axons to reconnect and damaged tissue to heal. 3, it's a potent suppressor of inflammation, which is a component of TBI, PTSD, depression, anxiety, chronic pain, and other neurologic disorders. And 4, it acts directly on nerve cells in the brain and spinal cord to enhance function and suppress pain. In treating TBI and PTSD, hyperbaric oxygen has had remarkable results over the past 20 years. It is universally effective.